All right, let's go ahead and get started. So this video is going to be some more practice questions, and these are over blood disorders. So that's going to include things like anemia, polycythemia vera, aplastic anemia, iron-deficient anemia, and blood transfusions. So the purpose of this video is to kind of start going more in depth into scenarios you might see with these blood disorders, and start really getting into some test taking strategies. You can read all the information in the world and have the book memorized, but if you don't really know what can happen with these disorders or how to, look at situations or scenarios around these disorders, that's where a lot of students get stuck. So this isn't the end all be all, but hopefully it'll help to get you started in thinking about these disorders. So let's get started. So question 1, a client with aplastic anemia is being discharged home. Which statement by the client indicates that more teaching is needed? So first, we always want to look at the question and see what is it really asking us. So it says that they're being discharged home. So you want to think about what period of time am I in? Like, are they in the acute period of time, like where there's something major happening, they're super sick, or are that like it's a new thing, or is it like, hey, they're stable, they're getting ready to go home? And so this one, they're being discharged home. So they must be ready or stable to go home. So usually you're not thinking about what do I need to do first or what's priority, but you want to be thinking about, okay, in general, how can I help this patient? And with discharge teaching, we're usually either teaching one, how to prevent them from needing to be readmitted, to keep them from having to come back, or 2, how to prevent complications when they go home. And that usually might be around their medications or their condition, what we can help to prevent them, or like when they need to call, that kind of stuff. So let's look at our options. And it's important to look, it says, which statement by the client indicates more teaching is necessary or needed? So you always want to look at a question like this and make sure you're reading that, like, which way is it, what's the inflection? So is it telling me that the teaching is correct or incorrect? So it says, which statement by the client indicates more teaching is needed? So it's saying which one of these is wrong. So it means 3 of these are correct and 1 of these is incorrect. So we have to figure out which one of these is incorrect. So answer choice 1 says, I will use a soft bristle toothbrush. So first I have to know about aplastic anemia and what type of anemia this is. And if you remember, aplastic anemia, A means without. And so they are without all their types of cells. So they have low white blood cells, low red blood cells, low platelets. And so they have low of everything. And if I remember correctly, if I have a high risk of bleeding, I want to use a soft bristle toothbrush. So I have to think, does a patient with aplastic anemia, are they at risk for bleeding? And with the low platelets, they're not going to be clotting as easily, so they are going to have a higher risk of bleeding. So using a soft bristle toothbrush, that sounds reasonable to me. Now remember, I can have 3 answers that are correct, so that's one of them. So I'm going to go through and check the other ones. I will need to avoid crowds and sick people. So again, we kind of talked about aplastic anemia, low of all the cells. Who would need to avoid crowds and sick people? Well, those that are at risk for infection. So I have to think about, would someone with aplastic anemia be at risk for infection? And the answer is yes, because they have low white blood cells. They don't have that immune defense they need to fight infection. So far, I've used 2 of my correct answers. So I'm still looking for 1 that's correct and 1 that is incorrect. I will require monthly blood transfusions. Well, I like the blood transfusions part because I like that because they can be anemic. I just don't know if they need them monthly. So that's what the thing that you always have to look at is, even though part of an answer might seem really good, the whole answer has to be correct. So saying monthly blood transfusion, I don't know about that. I'm going to hold on to that one and go to the next one. I said I should space my activities throughout the day. So that's like energy conservation. So I have to think about, is this patient going to maybe have trouble with, oxygenation or anything at all? And if they have anemia, like the low red blood cells, they could have, less oxygen carrying capacity and have some dyspnea, especially with exertion. So that actually does seem to make sense. So we have 1 answer that's about low platelets. We have 1 answer that's about low white blood cells. We have 1 answer that's about low red blood cells. So then in between C and D, I have to think, like, let's say that I'm down to them and I don't know which one of these is correct. I have to think about which one sounds most reasonable or most helpful or will most directly help the patient. I can't see them getting monthly blood transfusions, but I do think, because you always want to think about what sounds a little bit more extreme, and getting monthly blood transfusion, that seems like a lot. So I'm going to go with A, B, and D as being correct. So that means my incorrect answer, that is the correct answer choice for this question, is going to be C. So in other words, sorry for saying that confusing. This is not a select all that apply. But remember, the answer choice we're looking for is what is incorrect, what indicates more teaching is needed. And this patient may or may not require blood transfusions. They're definitely not going to necessarily require monthly blood transfusions. It's not a normal part of treatment. So C is correct, that more education is needed. All right, so a client with iron deficient anemia is receiving ferrous sulfate oral solution. What should be reported to the physician immediately? So this is a medication question, and it's asking me about iron deficient anemia. They're receiving ferrous sulfate, which is an iron suspension. They're getting by oral or by mouth. And says, what should be reported to the physician immediately? So by the looks of these answer choices, it's trying to help me to discern which of these which of these things are expected for a patient taking oral iron. And when it says report to the physician immediately, which of these shows that there is a big problem going on that needs like immediate intervention? So some of these, it may be something, maybe I do need to tell the physician, but which do I need to tell the physician immediately? So client complains of nausea after administration. So this is really asking me this, like what you could do is you could rephrase this and ask yourself, is it expected for a client to have nausea after getting ferrous sulfate? And if I remember correctly, it can cause a lot of GI symptoms, including nausea, vomiting. So I'm going to say that, while I might need to get some nausea medicine if it's, recurrent, etc. It's not something that I'm like, oh my God, quick, they're having nausea, I need to call the doctor right now. Like it's a sign like they're having a really serious complication. All right, so then it says, client complains of shortness of breath at rest. So what do you call them? If they're complaining of shortness of breath at rest, that could be a sign that they are not doing well with their anemia, because most of the time when they have shortness of breath, it'll be like with activity. If they're getting shortness of breath at rest, their hemoglobin may be seriously low. So I don't like that. That's kind of something I normally would call the doctor about. So I'm going to kind of keep it on the back burner. Let me see what my other answer choices are. Client has black tarry stools after administration. So that's expected, that's again, you can reword it. Is this expected for a patient receiving ferrous sulfate? And if you look at any of the iron solutions or suspensions, they're all black. And so they can cause black tarry stools. That also leads me to D, where it says client has a black stain on some of their teeth, especially if I don't have them use a straw, it can more often stain their teeth and it will stain clothes too. So be very careful when you're administering it, not to spill it on yourself or the patient. Those are both expected. So I have A, C, and D, which are all expected things from getting ferrous sulfate. But B, if they're getting that ferrous sulfate, they should be improving, not getting worse. And shortness of breath at rest, that's usually a sign that their anemia may be pretty severe. And so we'll definitely maybe want to check a hemoglobin and get some orders done. If nothing else, they may need some oxygen therapy, etc. So we'll definitely want to intervene in that. So really this question is asking you what's expected or what's a sign of a problem with iron deficient anemia, especially in someone who's taking ferrous sulfate. Now I know you might not like that answer. You may be looking for something else a little bit more, a little different or something more related to the ferrous sulfate. But with this one, you can either do it by a process of elimination, or again, you can just ask like, hey, if I had this happen, is this something I need to report right now? So yes. All right. So B is the correct. All right, so a nurse is caring for a client with polycythemia vera. What intervention will be most helpful to this client? So when it's asking for most helpful, it's trying to say which of these interventions is going to most directly help this patient to get better. And so all of these things could possibly be helpful to them, but maybe one is the most helpful, or a lot of these might be wrong and they're not going to be helpful. And then we have to figure out which one is going to be helpful. So it kind of just depends. We'll have to look at the answer choices. But either way, you want to see it has to relate to polycythemia vera. It has to be something that's going to help them to improve. So first, we have to remember what polycythemia vera is. Poly is many. So like aplastic anemia, A is without, so they're without cells. Poly is many or multiple, and they have many cells. They have high of all of their cells. So let's go through our answer choices. Our first choice is A, is to limit fluid intake to no more than 1 liter per day. So if I have a whole bunch of cells, I think I remember you have really like thick blood, and I think you want more fluid. So I don't think you want to limit fluid intake. So I'm going to say that's incorrect. Get yearly vaccination to prevent illness. Well, I mean, generally that sounds great. This is one of those things where it says what is going to be most helpful to this client. I mean, maybe they're going to need their vaccinations, but is it going to actually help them to stop making so many cells, or to make it where their blood's not so thick, or prevent complications? I don't know. I think that's more applicable to patients that have like low white blood cell counts, etc. Teach a safe environment and how to prevent trauma. What do you call them? Well, definitely, I definitely don't want them to, have, have any trauma and stuff like that. I think anyone needs to learn that, but you have to think about, is this really specific? Like, are people with polycythemia vera really at high risk for bleeding? And like B and C are much more applicable to like aplastic anemia versus polycythemia vera. Because with polycythemia vera, one of my biggest concerns is going to be clotting, not bleeding so much. And so, we have to think about which one is going to help mostly to prevent complications of this, or to advance their condition. Now, going on to D, it says administer antiplatelet medications daily as prescribed. So the only intervention that's going to actually help to advance the condition of polycythemia vera is going to be to administer antiplatelets. Now, that's because I've ruled out A, B, and C cannot be correct, or they don't seem as helpful. But if I think about, like I just said, one of the most, the biggest complications, or the biggest thing, you should always think with polycythemia vera, that poly-C, think polyclots, or poly-C for coagulation, where they're really high risk of clotting. And so, I know you probably think, why aren't they on anticoagulation? But there's just really high risk with anticoagulation. So they usually just do antiplatelet medications daily to help treat their condition. So D is the correct answer, because it's the only one out of all these choices that is specific to polycythemia vera, and it's going to be the one that's going to be most helpful, because it's going to help to decrease their risk of clotting, which is their biggest risk. Now, you can look back at C and say, hey, because they're on antiplatelets, I want to teach them a safe environment and how to prevent trauma. Yes, that's true. But out of all of these, the only one that's actually going to directly help to treat the condition is going to be D, the antiplatelet. So I do see if you are a little confused, because you're like, well, kind of, but we worry a lot more about trauma and like the bleeding and stuff like that with anticoagulants, even though we do still teach it at a low level with antiplatelets. So we do more of the no contact sports, that kind of stuff with anticoagulants. With antiplatelets, it's not that we're like, hey, go out and do some heavy contact sports, but there's a little less of a concern. It's a little bit more of a puny or a baby when it comes to how much of an effect it can have on your bleeding. So sorry if I've talked myself in a circle. Effectively, A, B, and C. A is not helpful at all. B and C are more applicable to other blood disorders. They may possibly be helpful, but they're not as specific or as helpful as administering that antiplatelet daily. All right. So let's go on. Question 4. Oh, and it's a select all that apply. You guys love these. So a nurse is preparing to administer a blood transfusion to a client. What does the nurse need in order to complete this administration? Blood transfusion questions. So first, A is intravenous access placed in, real quick. Select all that apply. We do these as true, false. We're going to start at the top, make our way down. And this is probably more like a knowledge question, just saying, hey, true or false. The important thing with these is sometimes when there's a long list like this, you want to make sure every part of the answer is correct, because sometimes we'll kind of throw in something there for a loop. So A is, let's go down, true, false. Intravenous access placed in the client. True, I need IV access in order to give a blood transfusion. B, lactated ringers, intravenous fluid. So I know I need IV fluid, but can I use lactated ringers with blood? I'm pausing there to let you think. And the correct answer here is no. There's only one solution that is compatible for blood transfusion, and that's going to be normal saline. So I've just got A. So B, false. C, IV tubing, including Y-type tubing set. That's true. I've got 2 of my answers now. And I'm gonna stop keeping count because some people, they're like, oh, it has to be at least this many or not so much. So we've got A and C. Now let's go to D, consent for receiving blood products. Absolutely, you gotta have consent before you can give a blood transfusion. So I have A, C, and D. E says diphenhydramine, 25 milligrams PO prior to infusion. So I'd have to know what diphenhydramine is. I have to think about, is there any medications the patient has to have in order to do this? Now, a patient may need some Benadryl prior to the infusion if they've had a previous reaction, but it's not a standard. We don't give everyone Benadryl. So I'm going to say no for the Benadryl, 25 milligrams. And then the last one is recent set of vital signs, blood pressure, SpO2, temp, respiratory rate, heart rate. That sounds great. So I think my correct answers are A, C, D, and F. And that is correct. That is what I need. We always want to have a recent set of vital signs. We need to have our appropriate supplies, including IV access, normal saline, Y-type tubing set. Got to make sure we have our consent. And then we get a set of vital signs to compare to have a baseline so that after we're starting to take their vitals after they receive the blood, we can tell if they're having a reaction. Question 5. A nurse is administering blood to a client. After 1 hour of receiving blood, the client complains of shortness of breath, has increased work of breathing, and has coarse lung sounds. What is the priority action? So A is, real quick, let's go back to the question. I'm going to keep getting ahead of myself. See, this is what happens sometimes on y'all's exams, is that you jump right into the answers before like really know what the question says. So let's look. So they're administering blood. There's 1 hour has passed. Now they're having symptoms. Their symptoms are shortness of breath, increased work of breathing, coarse lung sounds. So they're showing signs of trouble breathing and that they're having like wet lung sounds. There maybe is a fluid problem. So what's the priority action? So I have a fluid problem 1 hour after receiving blood. What do I do? So the first answer, it says, what's the priority action? So what's most important? So there could be things on here that we might do, but what's going to be the thing I need to do first, or what's going to have the most direct or helpful effect? A says, stop transfusion and infuse 1 liter of normal saline. Well, a lot of people are going to like that stop transfusions. They may just choose that one without looking at the whole answer, but it seems like they're having a water problem or a fluid problem. So I don't think we want to infuse 1 liter of normal saline. So I'm going to say no to A. The next one says, check the client's current vital signs, including blood pressure. Well, I think I definitely want to do that. I want to see what their blood pressure is. I don't know if it's what I want to do first, but let's take a pause and keep going on to the next one. Put the client in an upright position with head of bed at 60 to 90 degrees. Well, if they're having trouble breathing and they have wet lung sounds, I bet sitting up would definitely help. And that's something I can do quick and maybe one of the first things I can do. So now I'm between B and C, but let's look at D. D says administer epinephrine 1 milligram immediately. Now, epinephrine, that's that medication that we use for like anaphylaxis. So it helps to vasoconstrict and, helps to get my sympathetic nervous system going. I don't see any reason why they would need that. Their airway's not closing. They're not having an allergic reaction. So I don't think this applies to this one. So now I'm between B and C. So now I'm here. I have to choose what the priority action is. So, so far right now, it's telling me that do I either sit them up first or check their vitals first? And so I have to think which of these is going to best help this patient right now. Would putting them, which of these is going to help with their problem right now? Now, I definitely want to know what their blood pressure is and check their vital signs, but knowing those numbers is not going to help my treatment as much as putting their head of bed up. Putting their head of bed up helps to start to help with their symptoms and their breathing, which ABC is you always want to start with helping their airway and breathing first. And then once I put their head of bed up, then I can check their vital signs, get information, call the doctor, and get some orders. So C is the correct answer here. 6, a nurse is administering blood to a client. After 10 minutes, the client complains of itching and develops a rash on their left arm. What type of transfusion reaction is the client most likely experiencing? So this is another question we can ask. So when it comes to blood transfusions, we could ask you directly like, hey, here's symptoms. What type of reaction is this? We also could ask you like have, we could have a list like on the last one where it's like, hey, here's the symptoms and stuff they're having. What are you going to do about it? So pretty much we can ask you, here's a reaction. What are you going to do about it? Here's a reaction. What is it? And those are a couple different ways that we can kind of approach questions like this. So if you're wondering like, how could you ask a question about this? It's usually either about what kind of reaction is it or what are you going to do about it? So nurse is administering blood to a client, 10 minutes. Like we said, we have itching and they have a rash in their arms. Now, this is just a knowledge question. What kind of reaction is this? So I have a mild allergic reaction. I mean, that sounds about right. They're having itching and a rash. That sounds pretty, and as I start scratching my head, you know, when people talk about itching, it makes you start to itch. It's really bad when you get a patient that has like bed bugs, or you have a patient on the floor that has bed bugs and someone's talking about it. You just start like, ugh, you just start feeling itchy. Anyway, hemolytic transfusion reaction. I feel like that one's more serious. I don't feel like that's this one. I don't think they have itching or rash with that one. Severe allergic reaction. All right. So here, like this might be that I'm down to A and C. I have to see, is this a mild or severe? The last one's febrile. I don't see anything about a fever. So I'm going to say it has to be either A or C. And if they're just have itching and develop a rash on their arm, that sounds more mild. If their airway was closing, or if they were having a more severe like breathing problem, I think it would be severe. So the correct answer here is A, mild allergic reaction. Last but not least, so there's also a lot of labs related to blood disorders. So another type of question we could ask is related to what's going on with the labs for these patients. So it says a nurse is reviewing laboratory values for a client with iron-deficient anemia. What results would the nurse expect in this client? And this is a really common type of question where in the answer choices, they have like opposites. You have to figure out which one. So students can really easily get confused with this and be like, forget like which is high and which is low. So for me, it helps to draw it out. So on your scrap paper, sometimes I have to think about which is which. So if you're I was going to say your nurse, your instructor allows you to write out like brain dump in the beginning. This is a great thing to brain dump is lab levels. And so for iron deficient anemia, you don't have to necessarily know all of the normals, but you need to know what direction they're in. So for this one, we have to see like, first of all, like, what do we think things are going to be? So it looks like for all of them, the iron's low. Okay, that's what I would expect too. So now I just need to figure out what's going on with my ferritin and what's going on with my total iron binding capacity. So if I remember correctly, and it looks like for ferritin, they're both high. So it looks like really my only thing. So let me tell you my strategy that I did here. First, I was looking at iron. Hey, iron deficient anemia. I know my iron's low. Well, every single one of these choices has a low iron. So I can't use that to cross anything out. So then the next thing I was going to look at is, okay, well, the next thing I'm going to do is look at whether my ferritin is high or low. So let's say that I knew this and I knew my ferritin is going to be high. Sorry, did I say high? I meant to say low. I was like, hold on. I need to check something. All right, I got myself twisted into not myself. And this is what happens. Like I can teach this stuff and I just went over this stuff myself, but sometimes I have to in my own head. This is why these questions are confusing because sometimes in my own head, I'm like, wait, I'm talking myself into a quarter. So let's say, so I've discovered that the iron's supposed to be low. And then what do you call it? This is one where there's two lows and one high. And I just have to remember which one is which. So there's always going to be low iron in iron deficient anemia, but there's also going to be what do you call it? Low amount of ferritin. So ferritin is what do you call it? Kind of the stores of iron and stuff like that. So if I don't have a lot of iron, I'm not going to have a lot of ferritin either. So I'm looking for one that has low iron and low ferritin. So that's going to be I'm narrowing my answers down now to B and C because I have low iron in both of them and low ferritin in both of them. Now I just need to figure out what's going on with my total iron binding capacity. So if you remember, this is that one that's like the stores or the parking spaces, I always say, for iron. And whereas ferritin, so I don't want to say the stores because ferritin are like the stores or like kind of the marketplaces for iron. And so if my iron's low, my ferritin's low. And if I'm confusing you here, just go back and watch my blood disorders video when apparently I knew what the heck I was doing. So yes, too many topics, not enough time. But anyway, iron itself is going to be low because I don't have a lot of iron. I'm low on iron because I don't have the supplies I need to make red blood cells. Ferritin's low because if I don't have a lot of iron, I don't have a lot of ferritin. But then total iron binding capacity is parking spaces. So it's pretty much saying how many parking spaces are available for iron to bind. Well, if I don't have a lot of iron, if I'm not using a lot of iron, I'm going to have a lot of open parking spaces. So I always compare this to like in the semester, like early on, there's a ton of students going to class and there's not a lot of parking spaces because everyone's using them because students are coming to class. But as the semester goes on, there is less and less students coming to class and less need to come to campus, and students start to lose their fervor. So as the levels of students drop, or actually students drop out, etc., we have more parking spaces. So just like that, it's the same in iron. So the correct answer here is going to be C, because we have low iron, because we are deficient in that. We have low ferritin because we don't have a lot of storage of iron because my iron levels are low. But we have tons of iron parking spaces, or places for iron to bind, because they're not using them because there's not a lot of iron. So C is the correct answer. And thanks for your patience with me as I had to take a pause and make sure I was not losing my mind, because I lose my mind on average at least twice a week. And I guess that this was my the time I was supposed to lose it. But anyway, so the correct answer here is C, but I think it is actually helpful that I lost my mind at this moment, because maybe it showed you how easy it is even for your professors to have a moment and be like, let me look at this again. So questions like this can definitely confuse you. Make sure you're reading sometimes for me, even drawing arrows helps, and really thinking about which one of these is correct when it comes to the direction that all of these labs are going. So yes, anyway. That is the last question for this PowerPoint. Luckily, before I lose my mind any further, I hope this helped. I'll see you for the next one.